Let's look at another doctor who has potential to perform very well. I would say has potential to be in the top 100 ranks. Right now, this PrepDNA doesn't look like we'll get top 100. This is certainly a top 1,000 PrepDNA, but I feel this person has the potential to be in the top 100. Why do I feel so? Because there are some markers that I look at. Biochemistry, of course, is a first year subject, but apart from that, the second year block, if you look at social preventive medicine, microbiology, pathology, pharmacology, out of these 5 subjects, there are 4 of them that this person is very strong. This is a very good sign. If you remember earlier that um, the top 50, 100 ranks kind of people tend to do very well in microbiology and biochemistry because they are fine foundational subjects. Anyway, so that's the reason I feel they have potential to do well. If you do well in these foundational subjects, you can go and guess your way, or rather do process of elimination on things like medicine and surgery. So you can even do these mega subjects pretty well thanks to having these fundamentals clear. Anyway, those are some of the hints I look for in PrepDNA. Now, what advice could I give this person if this is what your PrepDNA is like? You you have to, of course, improve on some of these subjects. And in this case, these are your strengths, and some of them you have to make them stronger. But some of these weaknesses, particularly pharmacology and orthopedics, radiology, ophthalmology, so these should be, especially the smaller subjects like radiology, should be easy to fix. Let's go down and look at some of the statistics, and we can come back and look at PrepDNA again. You see the person has been steadily improving in spite of being pretty high on scores in the last couple of months. Now, this is not surprising that they are 94% on easy. That's a good accuracy score for easy questions. And that's a very good sign. It is a sign that this person will do well. 71% for moderate is not bad too. Of course, it can improve further. Where this person has to work hard on is improving the hard side of it, because you will not get top 100 with 44% in hard. This needs to go up to 50 or 60, 65. And getting it above 55, 50, 55, 65 will require hard work. And the hard work will be on 2 things. One is, of course, go and look at your weaknesses, and especially the vulnerable weaknesses, and get these to yellow. These reds should not exist. And 2, take your strengths. At this stage, the person who's in the top 1,000 range, there's potential to play to your strengths and make them stronger. Make this biochemistry, microbiology, pathology even stronger, and that will give you an edge over the others. But let's look at the left-hand side and see what we can learn there. If you look at ortho, there's a very clear sign on what you can improve here. This should not be, these are a few topics out of a big range of topics in orthopedics. And how do you improve on these? If you actually go down and see how this person performs in overall questions, we can take a guess. You can see that the easy performance is pretty good, but needs to improve on moderate and hard. Again, there is potential. I bet these numbers will go up if they practice these weak topics, and it shouldn't be very hard to focus on these. Let's look at pharmacology too, because I mentioned it as being important. Again, about 40% of pharmacology is what this person needs to focus on. If they focus on this 40% of pharmacology, there would be a lot of improvement. I wouldn't be surprised if they are doing badly on easy questions here. There you see, it's easy questions is almost just at 80%. That's a lot of scope for improvement. If this 80 goes to 90, that is not making the most fundamental mistakes. Going back and reading some more on notes and practicing a lot more will help this doctor do a lot better on pharmacology and also give better foundation on it. Again, it's a matter of practice and going back and doing some more notes. I think that's it. That's a very clear direction forward. I think this person needs a little more practice and not just focus on the weaknesses but also make the strength stronger.